Tonsils, located at the back of the throat, are two tissues that filter germs that could cause infection. When they become infected, ear, nose, and throat specialists calls the condition tonsillitis. Today on Sound Health, we will find out how to manage the condition, also known as BELU. I'm Olasumbo Modukwe. Welcome to the show. Thanks for staying with us. It's still Sound Health on Lagos Television, and today we are looking at tonsillitis. Dr. Bayode Afuye, a consultant ear, nose and throat surgeon, will take us through how to manage the condition. Welcome to the program, Doctor.
Pleasure to be on the program.
Okay, according to a report by the College of Medicine, Ibadan, at least 100,000 people are affected by tonsillitis. To start with, what is tonsillitis?
Tonsillitis is also known as sore throat. It's an infection or inflammation of the tonsils. And what are the tonsils? Tonsils are a pair of lymphoid tissues that are located at the back of the throat, one on each side. They are part of the body's immune system. They form a barrier against microbial infection of that part of the body, upper aerodigestive tract. That is the entrance, the port of entry of food, air into the body, and also bacteria. So they tend to wall off this infection for the part of the body. But sometimes in carrying out their function, they are overwhelmed by this microbial invasion and they also get infected.
Okay. What are some of the symptoms to look out for when tonsillitis sets in?
Well, there are many symptoms. Some of them are fever. The patient begins to feel feverish, body pains, headache, and they complain of pain in the throat, difficulty to swallow, and painful swallowing.
Okay.
Sometimes when you examine them, they have painful neck swellings. Those are neck nodes around the neck and the jaw. Okay. They sometimes have limitation of mouth opening. That is trismus, and that's because of pain. Some of them have muffled speech, what we call hot potato speech. That's as a result of the large swellings in the throat. Okay. The pain sometimes radiates to the ears. And when you examine the throat, the tonsils, which you have one on either side of the throat, they are bigger than usual. They are inflamed, they appear red. And sometimes you have exudates, what we call pus, on the surface of the tonsils. These are pus emanating from the substance of the tonsils. Then among children, they are usually, generally they are irritable. They may begin to refuse their food, vomiting, and sometimes diarrhea. They appear ill-looking. Tonsillitis is also an important cause of fever, what we call paresthesia of unknown origin, especially among children. Those that are too young to tell you they have pain in the throat. You think they have malaria, you've carried out all the malaria tests, you've treated them, and the fever persists. Just looking into the throat, the cause of that fever, or sometimes febrile convulsion, will just be there.
I would like you to enlighten members of the public. Are there any similarities between tonsillitis and sore throat?
Well, tonsillitis specifically refers to inflammation of the tonsils.
Okay.
Yes, whereas the term sore throat, that's inflammation of the whole throat. It may be diffuse, not localized to the tonsil alone.
Okay.
The wall of the pharynx and everywhere are inflamed. But by and large, they are usually used interchangeably.
Tonsillitis is much more common in children. What are some of the symptoms to look out for when the condition sets in, and what can be done to prevent this in children?
Like the symptoms I mentioned, especially among children, they are irritable, they refuse their food, they vomiting and diarrhea, but the older ones are able to tell you that they have pain in their throat.
Okay.
Most cases of tonsillitis are actually viral in origin. They may be mild. Those ones, the symptoms are mild, they are self-limiting, and they may resolve spontaneously over a period of a few days.
Okay.
However, when symptoms persist, especially in the face of persistent fever, difficulty to swallow, vomiting, the parents should consult a doctor.
Okay, doctor, is tonsillitis contagious, and are there possibilities of a relapse in someone affected by the condition?
Yes, it is highly contagious.
Okay.
It is contagious. It is particularly common among children. The peak age is between 12 and 5 years, because at that age, their immunities are not well developed. And that is the age when they begin to leave the home environment. They mix with large number of other children and adults, especially in daycare, nursery and primary schools.
Okay.
And you will agree with me when you have a large gathering of children, 20 to 50, at any point in time, it's likely that one of them will be having common cold or sore throat. And when these ones begin to sneeze or cough,
Okay.
the air around them is laden with high number of airborne droplets that are containing microbes. So when other children inhale this the droplets, they may come down with tonsillitis, and that explains sometimes why incidence of sore throats tend to be higher during school period as against holiday.
Okay, doctor, aside from diphtheria, are there other medical conditions associated to tonsillitis?
Yes, diphtheria is one of them. It's an important infection among children 5 years and below. It's caused by the bacteria Corynebacterium diphtheria. It's a leading cause of death among children who are 5 years and below. And the outcome are usually not good, outcome of even with treatment. The good thing about diphtheria is it is completely preventable by immunization. So parents are advised to take their children for all the immunizations. And another related cause is common cold. Some of those, most cases of tonsillitis are actually viral in origin, about 70% of them, and only 30% are bacteria. So when the common cold, when children begin to have common cold, it's an important source of this infection to the throat. They have runny nose. Sometimes they swallow part of this mucus containing the microbes. Then I think it's also important to mention Lassa fever, because currently Nigeria is facing an epidemic of Lassa fever, and most of its symptoms are similar to those of malaria and tonsillitis. So it's important that physicians attending to patients with sore throat should exercise universal basic precaution. They need to protect themselves using personal protective devices, use of hand gloves, face masks, regular hand washing, barrier nursing. And sometimes when you have cases that you are suspicious of Lassa fever, it's important to report such cases to relevant health authorities. Then at the level of the community, the virus is carried by the multi-mammoth rats that live around the house. So one should prevent or discourage entry of rats into the house. Clear the bush around the house and block all the entry points where rats can enter the house. And all foodstuffs should be kept away from rats using rodent-proof containers. Then hand washing.
In this part of the country, the southwestern part to be precise, we refer to tonsillitis as BELU, and people seek traditional cure. What's your take on that?
Well, I strongly advise that if you have anybody has sore throat, you should consult a doctor. The traditional way, it's risky, of treating it is risky. I've seen patients who, after some bouts of sore throat, decide to visit traditional healers, the surgeons, local surgeons. The risk with that, to start with, the tonsils are at the size of the throat, not at the center. But these traditional healers tend to go for uvula. That's the one that hangs from the roof. That's what they cut and leave the tonsils. And in the process, they can also damage other structures because they use knife, damage other structures. Patient begin to bleed excessively, which they cannot control. And also the risk of infections, other infections, because their instruments are not sterilized. Risk of HIV infections, hepatitis infections, and sometimes the wound itself gets infected because there's no use of antibiotics after such treatment and surgeries. Then sometimes people use all sorts of solutions, dry gin and other things to wash mouth. There's no proof that they're actually effective.
When does surgery becomes an option when tonsillitis sets in after using so many medications and so?
In case of tonsillitis, the main indication for surgery is recurrence.
Okay.
When a child or even an adult begins to have recurrent sore throats, they experience discomfort, pain, and also costs of treatment in terms of drugs and even time. Children is a major cause of absenteeism from school, and also adults from work. So to prevent this and minimize the cost and suffering, we go for surgery. The surgery is called tonsillectomy. An indication for tonsillectomy, when is it recurrent now? The definition for recurrence, when an individual has 6, that is more than 5 episodes of sore throat, established sore throats within 12 calendar months, is enough to go for tonsillectomy. Or when you have 4 or 5 episodes per year for 2 consecutive years, or 3 episodes every year for 3 consecutive years, it's enough to go for surgery.
Okay, doctor, what are some of the steps or lifestyles to adopt to prevent tonsillitis from setting in?
Poor orodontal hygiene is a risk factor, so people should take care of their oral hygiene. Then overcrowding, I mentioned the case of children in a crowded environments. People should avoid overcrowding situations, especially in the presence of poor ventilation. And then minimize contacts with individuals with active sore throat. Then patients with sore throat should avoid open sneezing and coughing in public places. This they can do by using the use of handkerchiefs. They can cough or sneeze into the handkerchiefs.
On a final note, in this part of the world, we hardly visit the ear, nose, and throat specialists. What's your advice? How often should one visit an ENT specialist?
A lot of people are guilty of that. They hardly visit their doctors generally until they are healed. And in the case of ENT, until they have an issue, a serious issue with their ears, nose, and throats. I recommend that everybody should visit the ENT surgeon at least once in a year. Particularly, there are some set of people who are at risk of developing ear, nose, and ENT conditions, especially those that are predisposed by their occupation, what we call occupational hazards. Okay. Protection of hearing. So those that work with factories and engage in noisy vocation, there's a need for regular hearing assessments. Protection of hearing loss, hearing damage at work, and also it should be part of the program for employers of such people to send their staff for regular, in fact, annual hearing assessments and advice.
Thank you so much, Doctor, for sharing your expertise with us on tonsillitis.
Thank you very much. It's my pleasure to be here.
All right, that has been Dr. Bayode Afuye, a consultant ear, nose, and throat surgeon on managing tonsillitis. Sound health continues with trending and home essentials. Please stay with us. The program continues in a moment.
This week on Sexual and Reproductive Health Rights. Sexual and reproductive health, including family planning, is critical to the fulfillment of human rights. Family planning is widely recognized as one of the most cost-effective health interventions. Decades of research have demonstrated that modest investments in family planning can save lives and dramatically improve maternal and child health. There is a growing push in the development community to reprioritize family planning because of the cross-cutting role it plays in achieving broader development goals, including the Millennium Development Goals and poverty reduction. Most fundamentally, access to sexual and reproductive health services enables individuals and couples to plan their sexual and reproductive lives, forming an essential aspect of human dignity and freedom. As pronounced at landmark United Nations conferences on women, population and development in Cairo in 1994 and Beijing in 1995, the right to control the number, spacing, and timing of one's children is fundamental to exercising reproductive rights. To do so means that individuals and couples must have the information and means to make informed decisions regarding their sexuality and reproduction. Moreover, the human right to family planning enables the exercise of other human rights, such as gender equality, for example, by allowing women to expand their life opportunities, increase their negotiating power, and raise their socio-economic status.
Remember, a visit to an ear, nose and throat specialist once a year will reduce your chances of tonsillitis or any other infection. That's Sound Health today. Hope you've learned a few things. For comments and inquiries, please share your thought with us on 0818-815-3695 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.